Carbohydrates provide energy as well as many essential vitamins and minerals. However, carbohydrates that are not needed immediately for energy are stored and can eventually convert into fat. In this module, we discuss your daily carbohydrate requirements and take a closer look at some of the challenges that carbohydrates, like refined sugars, may cause after weight loss surgery.
Carbohydrates can be divided into two main categories. You find first your simple carbohydrates, which are things like sugar, and also fructose, which is a natural occurring sugar in fruit, and also lactose, which is a naturally occurring sugar in milk. The other category of your carbohydrates are your complex carbohydrates, and these are the ones that we want you to focus on after surgery. Your whole grain breads and cereals, your beans, and also your starchy vegetables like corn and peas. Initially, your carbohydrate goal is to get 50 grams in or less. You want to, again, focus on your fruits and vegetables and your whole grains, and make sure that as you introduce fiber back in, that you do it slowly, because you need to allow your stomach time to heal. You can introduce raw fruits at 3 weeks and raw vegetables at 4 weeks.
Lactose intolerance is one of the problems that some of our patients might face after a weight loss surgery. I think that gastric bypass patients are probably a little bit more prone to it. We see up to 20% of our patients who have Roux-en-Y gastric bypass having some intolerance to lactose, which is basically the sugar that's in milk and milk products. The symptoms that they have usually are going to be after eating something or drinking milk, or eating something that is made with a milk product. They might have gas, maybe a little bit of bloating, and sometimes loose stools. The important thing in terms of identifying whether or not you have lactose intolerance would be paying some attention to when you might have those symptoms, and sometimes using a journal or just jogging your memory that I'm having these symptoms and thinking about what did I eat. Dumping syndrome is something that is primarily identified with Roux-en-Y gastric bypass, and approximately 50% of patients who have that procedure will develop some level of dumping syndrome. Now, the dumping syndrome itself is a group of symptoms, but it basically relates to or is caused by a rapid shift in fluid inside the body. So, and the causative factor, or the thing that initiates that, is usually consumption of a significant number of simple carbohydrates or sugars, particularly refined sugars, table sugar, but it can also be caused by natural sugars that occur in high concentrations in certain types of fruit juice or even certain fruits. Symptoms that might indicate that you have dumping syndrome would be symptoms that would be caused by this rapid shift in fluids. Can be dizziness or lightheadedness, can be nausea. Many patients will complain of palpitations or rapid pulse, and just a general feeling of not feeling well. And usually the first thing that they feel like is, I need to lay down. And that's usually what we would recommend if someone has dumping syndrome, to lay down until the fluids begin to can re-equilibrate in your body, so that the symptoms begin to resolve. Another problem that some of our patients face that can be related to dumping syndrome, although they won't have the full fluid shift, or they won't necessarily have all the symptoms, the lightheadedness, the queasiness, the palpitations, but they may have some of the weakness or fatigue, and even some, maybe if profound enough, loss of vision, loss of consciousness would be a profound hypoglycemia, or low blood sugar. And it's thought that both of these things, both dumping syndrome and hypoglycemia, can be triggered initially by the consumption of simple sugars in significant quantities. So whereas the dumping syndrome may come on within 20 or 30 minutes of consuming simple sugars, hypoglycemia may actually take a little bit longer to manifest itself and may be a couple of hours afterwards. And so someone with hypoglycemia may feel that they're just not thinking straight. They may feel weakness and usually maybe even a little hunger. And they'll notice that if they do eat something, that sometimes the symptoms will go away.
Your daily goal for carbohydrates is less than 50 grams. Focus on complex carbohydrates such as whole grains and starchy vegetables. Introduce raw fruit after 3 weeks and raw vegetables after 4 weeks. Journal your food intake to help you identify the foods that may be causing you problems. Highly concentrated or refined sugars have little nutritional value and are added to many processed foods. Develop the habit of reading food labels. When possible, avoid foods with added sugar such as ice cream, pastries, cakes, energy drinks, and sweet teas. Remember to complete the assessment form and write down any questions you may have. When you are ready to continue, use the menu on the left to select the next module.